A number of countries, including Taiwan, have reintroduced travel restrictions specifically targeting visitors from China, for example, PCR testing on arrival. From a public health standpoint, how effective do you think these measures will actually be?
I don't think the measures actually have a lot of justification. Our experience in the past 3 years is that whenever there's a new strain of the virus, a new variant or a new subvariant, it finds its way around the world very quickly. If Taiwan blocks visitors from coming in directly from mainland China or has testing requirements or whatever, the virus can just come through a third location. It can come through Japan or through Thailand or through Vietnam or through somewhere else in the world, through the United States. So travel restrictions do not stop that from happening. They may delay it slightly, but they will not stop it.
Another concern some people seem to have is that new variants will start emerging from mainland China since the virus is widely circulating there among the population for the first time, really. How realistic do you think that threat actually is?
Well, I think it's a valid concern because over this winter, there might be up to 1 billion infections in China, most of them very mild, but up to 1 billion infections. That's a lot of opportunities for the virus to evolve, to find a new direction. But I would say around the world, in this period of time, in Europe, North America, other parts of the world, there's a lot of infections going on as well. They're just not reported because the world's moved on. There's not much testing being done. So I would say there's a risk of a new variant coming out of China. There's also a risk of a new variant coming out of other parts of the world. And we got to stay on our toes. We got to keep monitoring the virus, not only in China, but also in other parts of the world, so that we can see early on if there's something new that we need to be prepared to deal with. Hopefully that won't happen, but I don't think it's just something that we can stop. It's just something that we can identify sooner so that if we do need to make some changes, we've got time to do that.
Since the start of the COVID-19 pandemic, we've seen alternating rounds of these targeted travel restrictions, depending on which parts of the world are regarded as high risk at the time. And that's something Hong Kong itself did, of course. But what do you think is sort of the final verdict on this strategy? Has it proved to be effective in protecting public health and fighting the pandemic?
Earlier in the pandemic, stopping cases from getting into the community with testing, with very strict quarantines, that was really important. But now, I think everywhere that was doing that has moved on. And so that rationale has gone. There's nowhere in the world that I'm aware of that is still trying to keep daily cases to zero, daily infections to zero. So that rationale was there earlier, and it made sense for that particular strategy as a temporary measure, but no longer makes sense.